If you have ever felt pain like an electric shock, a burning sensation and the numbness shooting down your lower leg, then you have probably been told that you have sciatica. Sciatica isn't usually a diagnosis but a symptom. Now, if you understand how the nerve works, that is the sciatic nerve, then you probably understand the right exercise that you should do in order for you to alleviate the symptoms associated with sciatica. However, if you do not understand how how the sciatic nerve actually works, then you will not be able to understand the right exercise to do and the right treatment that will help you throughout the process. Most people treat sciatica by aggressively stretching their gluteus muscles or the hamstring muscles. But the problem is that if you are stretching the gluteus muscles or the hamstring muscles without knowing the source of the problem, then you are doing the wrong thing. Most of the times, sciatica is associated with a problem at the lower back region, that is at the disc level. And if you do the stretching exercises for the hamstring muscles or for the gluteus muscles, then probably you will feel relief in the first 1 hour or some few seconds, then your pain comes back, which means that you are not addressing the root cause of the problem. I am a physical therapist and I specialize in evidence-based rehabilitation whereby we view pain as information. The sciatic nerve is one of the largest nerves and the longest nerves in the human body. It's probably the size of your pinky finger, that is this finger, probably of this size. The sciatic nerve is formed by 5 nerve roots from the lower back region and it runs throughout the glute, that is the buttock region, throughout the thigh posteriorly, throughout the legs and up to your toes. So that is the length of the sciatic nerve. It is formed by 5 groups of nerves that come together and form the sciatic nerve. Now, because this nerve is a continuous nerve running from your lower back region towards your toes, any problem at the root, that is at the lower back region, may cause a problem anywhere within the course of the nerve as it travels, and also a problem at the gluteal region or at the thigh level may cause a problem downwards. So that is why when treating the sciatic nerve problems, you should focus on the root of the problem, Most people will literally think that the bone is crushing their nerves. You think that it is the bone that is crushing your nerves. However, what happens is that the bones as the disc herniates outside, impinging your nerves, what happens is that it will release chemicals, and these chemicals are what will cause inflammation and irritate your nerve fibers. Now, we don't usually need to move the bone. We should always focus on the cause of the problem. That is by focusing on some movements and also relative rest. So we focus on movement and relative rest. Now, pain is usually an information, but some information from pain is usually an emergency, usually a red flag. So if you notice these things, then you should know that your pain is a red flag and you should consult with your physician or your physical therapist immediately to get help. Now, if you notice sudden weakness, that is foot drop, that is you are not able to move your feet as you usually do, you drag your feet, then you should know that it is an emergency. Number 2 is numbness around the saddle area, Then number 3, we have bowel and urinary incontinence. You are no longer able to control your urine outflow and also your fecal outflow. Then you should know that this is an emergency, not merely a muscle stiffness, but an emergency and a red flag, and you should consult with your physician immediately. Now, as I've said about sciatica being a symptom and not a diagnosis. Now, if you want to manage sciatica the correct way, then you should focus on an evidence-based approach, that is the root cause analysis, RCA. Now, the root cause analysis, this is whereby we focus on the cause of the problems and not the symptoms. Treating sciatica doesn't involve addressing the symptoms without looking at the root cause of the problem. And to do this, you'll need proper history taking. After doing proper history taking, you'll do movement testing, that is accessory and physiological movements. Then you should also do some special tests and also range of motion. Now, if you do all this, you'll be able to gather information and data that will help you know where the problem is. Now, if you find the problem to be, most of the times the problem is not at the glutes or the hamstring. The problem is at the back region. Now, if you find the problem to be at the back region, then you focus on treatments that focus on the root cause of the problem. That is the cause of the problems. Where does the pain originate? The problem originates at the back region. Now, if you notice the problem to be originating, for example, at the L5 level, that is the lumbar vertebra 5. Now, if you find a problem at that point, then you should focus on treatment that will ensure that the problem is addressed at the cause, that is at the lumbar vertebra 5. Now, these treatment protocols may include giving some back opening exercises, that is foraminal opening exercises. You can also do usually manual therapy, and this usually works immediately. Now, what manual therapy will entail include the manual lumbar traction. Manual lumbar traction, you can do either supine or prone. You can also use a Swiss ball to help you in doing this. And also you can do the sciatic nerve glides. You can also do the sciatic nerve glides and also some exercises. Now, these are just but some of the treatments that can be given. You should also involve doing patient education. Education is one of the best things that you can do. This will include education on proper sleeping position, walking pattern, sitting posture, and many others. Now you train on ergonomics. Now that is why we usually say that evidence or research has shown that you should address the root cause of the problem using the RCA, that is the root cause analysis of the problem, instead of focusing on the symptoms. Now, to summarize, in order for you to truly fix sciatica, you need to do the following. Number one, identify the source of pain. Is it the spine or the muscle? Then number two, you should stop pulling at the nerve with too aggressive stretches. Too aggressive stretches only cause irritation. This is why I've said that you focus on the cause of the problem. Number three is that you should use nerve glides, and graded or gradual loading to desensitize the system. Now, those are some of the things that you should do if you have sciatica. Now, sciatica is a message and not a life sentence. Sciatica is actually treatable, and 90% of the cases are usually treated using the evidence-based or clinically applied physical therapy. Now, if you use an evidence-based physical therapy, then 90% of the cases of sciatica will not need surgical operation. However, some few may progress to surgery. However, 90% of the cases, if addressed immediately, the source of the problem is identified, then they will tend to go back to their activity without any problem. Thank you. Remember to subscribe, like, and share the video with anybody you feel needs this information.